Good morning. So let me start with the factor or the element of the hospital itself. So the protocol of the hospital. In this case, in this particular case, we had the issue of COVID. So the first thing that I was asked to do the first thing I was told to do was, you have the usual, at least this is what I've always known, the usual appointment with your doctor where I would get a sort of like a checkup / physical. You get a blood test that has to be done at least within 30 days before the spinal tap, where they check your protein levels, your CBC count, things like that. And then in this case, I got a call from the hospital. Once the doctor has submitted the script and everything to the request to the hospital, and I keep saying doctor because it could be, usually this is requested by the neurologist. In my case, it was a combination of neurologist and my internist. So that's why I keep just saying doctor, and I'm not talking about a specialist. Sometimes it is a neurosurgeon. Sometimes it could even be done by a neuro-ophthalmologist. That it's not as common, but it can happen. So basically then everything is submitted. The hospital calls me, at least this has been my experience, or you can call the hospital, schedule it, and then the hospital called and said, okay, now we need to make sure you're COVID free because of the pandemic. So first was the blood test for checking the antibodies, and then the day before I had to, because it had to be within, I believe they said it had to be within 72 hours, but basically it was I did it within 24 hours before. They had to be the swab. So I went ahead, did the swab test. I found out that afternoon that I was negative. So the next morning I went ahead to the hospital. So that was sort of the procedure beforehand. So then I went into the hospital. They did the typical check of your temperature, hand sanitizer, and of course I go in with a wheelchair. So in this case, my husband was allowed to walk me into the floor. I checked in, and I was wheeled into a private room, very small private room with a bathroom that you share. But in this case, coincidentally, there was nobody to share it with. I would assume that it was prearranged that way by the hospital. In that case, at that moment, the nurse comes in, and I will do a separate video on the nurse and the personnel. And then after about an hour to 90 minutes, I was stretched. In the stretcher, I was taken down to the room, the actual interventional radiology room where the fluoroscopy. And they help you onto the table of the fluoroscopy table, and there's the big machine that goes, around you, that, sort of goes around you, and that's where you sign in the pre-room you sign the papers, and then they bring you in. Afterwards, you go back on the stretcher. They help you on back to the stretcher. You stay completely flat, and you go back to the room. In my situation, the transport had to stop, and we had to wait 10 minutes in the hallway. We were asked to stop. The presumption was, even though I was never told, that there was a case probably of COVID way down the hall that was coming in, because it was the patient was completely surrounded by heavily gowned personnel. To this day I do not know. So Who knows? And then I proceeded back to the room. And like I said, the hospital was actually very, very good as to keeping distance. Everybody did wear a mask. A mask was required. I was asked to wear a mask all the time. I came in actually with an N95 mask and which was provided by my neurologist. She's wonderful. And then I also came in with a plastic not medical grade, but basically plastic mask that I kept on the entire time. I asked if I could, and they said no problem. Again, being that we have to take extra care of ourselves, I am honestly, I am. This is not something I take lightly. So I kept it on the entire time. I think at one point while I was laying down on the fluoroscopy table, it sort of fell off a little bit and I pulled it back on. Even though the hospital was very reassuring, and they did, I could see that behind me there was always a trail of protocol of cleanliness. There was at no point there was anybody anywhere near me except for a nurse or a doctor, and they were always cleaning their hands and things like that. So all protocol was followed. It was followed attentively. I could tell there had been training because of the difference between previous spinal taps. If I had never had anything to compare it to, I would think that this is the norm, and it was, to my point of view, was not the norm. But it was actually very nice. On the other hand, if you wanted a hug, that's a different story. But that was not what I was looking for. And dismissal was after laying down, I think, for about 3 hours. It was not the full 4 hours. I know other places keep you overnight. This has not ever been the case with me. I've never been at a facility that kept me or asked me to stay overnight. That has only happened with lumbar drainage. So in this case, after staying for about 3 hours, I believe, and they did offer me drink, and they asked me to drink quite a bit and something to eat. I was dismissed and I was wheeled down. My husband was not allowed to return, so basically he had walked me to the room, and then I did not see him again until I was wheeled to the car, and I was picked up then, and that was it. Like I said in the previous video, this time around they did not call me the day after, which did surprise me. I think that was the only sort of mishap of the hospital. But all in all, the procedure, they followed a very strict protocol, and it was actually, I would say, very, very effective. So I would say this is sort of the normal protocol of hospitals. I would say it was now including a COVID pandemic protocol. I think it was very effective. And the interesting thing to me is that usually I go into a lumbar puncture going, okay, which part of the protocol are they going to fail in? And I'm not talking just about my facility or this particular facility. I'm talking about any facility. And honestly, I have been in probably 8, something like that. And I have been not just in the United States, but I have been very dogged about finding places around the world where I could find a cure or an answer or treatment. And even in other places of the world, there's always some protocol that breaks down. And I have to say that this was the first time that protocol was pretty much kept to a T. I left quite happy, and I think that that's why a blood patch was not needed. So that tells you something. Just an opinion. Just an opinion. So this was the video about sort of the hospital and protocol type. Let me follow up with another video. Thank you.